I'm Dr. Cameo Carter, board certified pediatrician and mom of 3. Thank you for joining me at the end of my day. A question I get a lot over the years is about whether it'd be better to separate vaccinations or to combine them. And so I wanted to talk about a couple of those things. I can tell you, being a young kid myself who was terribly afraid of needles, I would have hated to have vaccines separated and have a bunch of additional pokes. So it's a common thing that trying to reduce the number of times a kid gets poked is a concern for some kids and their parents. And so I think there's definitely an advantage to combining them. We don't have any evidence that if we use combination vaccines, that as a whole, that's going to make there be a higher chance of there being side effects like fever, warmth, redness, and swelling, irritability, things like that. A caveat for that is the combo vaccination that has MMR and varicella with it. That's a vaccine that we give routinely, called ProQuad, at 4 years old. So, or 4 to 6 is the recommended time frame. And 12-month-olds, 1-year-olds, also are immunized against these things. They get the MMR and varicella. But the combo was shown that if you give it at 1 year of age, the combo together, you have a slightly higher chance of having higher fevers and higher chance of having febrile seizures. And so for that reason, most offices that I'm aware of don't give the ProQuad or the combo at the 12-month visit. That one is separated out. In other cases, we haven't seen that putting them together is going to be worse for kids in side effects or any other way. So for example, in my office, we use a combination vaccination called Vaxelis that has multiple vaccines in it that are making it so we have less pokes, and we don't have to do lots of additional injections, which would have more sites of soreness and be a source of irritation maybe for the kids just in their number of pokes. So one thing that parents seem to be concerned about is the ingredients that are going into vaccinations and why they're there. The vaccine isn't just the antigen, and the antigen is that weakened or inactive germ piece that we're trying to get the body to recognize. The reason that they're containing other things is to make them safe, to make them stable, and to make them effective. So the other ingredients that you're seeing in vaccinations are the preservatives. That helps prevent contamination. Stabilizers, that's what keeps vaccine effective during storage. Adjuvants is something that helps boost the immune response, so fewer doses are needed. And buffers and salts, that's what's keeping the vaccine at the right pH and compatible with the body. And then water is the main component, actually, and that's making it injectable, making it fluid. So the ingredients in these categories are really, really safe. They're present in very tiny amounts. They're much smaller than what we come in contact with in our daily life, what we ingest in food, in water, in our environment. They're rigorously tested even before they make it to market, but also monitored continuously. And many of these are occurring in our environment and in our bodies already. So then back to the question about should we split this up more? And some parents think that by splitting it up somehow, maybe it means it's fewer chemicals. And one thing to keep in mind is that when you do the individual shots or individual antigens and separate them into multiple shots instead of combinations, you're going to be getting extra doses of these stabilizers, buffers, and preservatives. So even though I feel very comfortable with them, and my own boys who are college age, I had them immunized as soon as they were of age that they could get the different vaccinations. So I feel completely like the benefit is way outsizing the risk for immunizations for them. So I didn't have any concern about these extra things. But for those people who are concerned about those different aspects, if you're separating it, then in effect, you're going to be having more of these ingredients that I have people ask me about a lot. So also, I think the other point is that if you were spreading out the immunizations more, there's more opportunity for side effects. There's more opportunity for warmth, redness, and swelling at the sites of the injection. There's more opportunity for fevers and the side effects that come with that. So if there is no increased risk of having these side effects when you do the combo, in essence, by separating these out further, you are kind of compounding that risk. So I think that it's a really important thing to think about when parents are deciding that they want to split up vaccinations, is to make sure they're thinking about those things that they're trying to avoid, they may actually be exposed to even more. Those additional ingredients are safe. They're essential for the vaccines to work. The safest lowest exposure path is the recommended vaccine schedule. Most of us in pediatrics have been doing this for a long time and are very accustomed to having these discussions, and really want you to ask questions and be open to the dialogue and the information. So if you have any worries for the things that you're hearing, be sure to ask your pediatrician about it. I know in our office we have a vaccine consult that we provide additional time for parents who are hesitant or worried or have questions about the vaccinations. And I think doing something like that with your pediatrician is always a good idea, so that these kinds of questions you can walk through with them. Thanks again for joining me at the end of my day, and I'll look forward to talking to you again tomorrow.